what indicators besides, case rates, hospital beds, and so forth, should we be monitoring right now? You mentioned doubling rate and beta rate. I'm wondering about our effective, other less discussed numbers. And I'm wondering, is there a threshold at which this disease could shift into an even higher gear than we've previously seen?
Well, I think all those things that you just mentioned are things that we would follow. I was looking at, I look at the number of new cases every day, and I look at whether or not we're seeing, back when we were doing pretty well in mid-September or early September, and our numbers of new cases a day were dropping in a couple hundred, a day. And now we're routinely over 1,000 a day. So that the fact that we're seeing that when the numbers of tests are not really going up appreciably tells me that it's spreading more. If the rate of spread if it were trying to double much more quickly, that would get me much more worried, because that could quickly overwhelm the medical system. Right now, our hospital system doesn't look to be particularly threatened. We definitely have a rising case number in the hospitals, but there is plenty of bed capacity at the moment. So that doesn't worry me as much at the moment. But what worries me is that although we're seeing a lot of these current new cases among younger people, though it's inevitable in my mind that these younger people might potentially transmit them to older people, and then that's going to shift the demographic to an older population that might end up in the hospital. So those would be things I'd be watching for: is the demographics. The R effective number and the beta numbers, they're just sort of two ways to say that this is spreading, and we see that. The numbers are rising steadily, so that's a concern.
Dr. LaBaer, Mike Pelton, C15. Appreciate you taking the time, as always. Question is, so yesterday the state and Dr. Krista put out a YouTube video. She had mentioned in that small household gatherings were what she believes are feeling some of this. I also talked with Marcy Flanagan with the county this week, who she had said schools, universities, social gatherings, et cetera, were feeling this. It sounds like you're kind of in line with what she was saying. I mean, I guess my question is, how do we pinpoint really what's fueling this? How do we figure out, is it schools, is it businesses, is it small household gatherings? How do we figure that out?
Well, I mean, I think one of the reasons that a lot of us do think that the smaller gatherings are fueling it is that we're, for the most part, we're not holding big gatherings right now. And so we can't see the smaller gatherings, but we have seen some evidence from them. There was recently reported on case of a lot of transmission happening at Chaparral High School because a couple of families got together and went on vacation together, and so that's been documented. And there have been other situations where in smaller groups we've seen super spreader type events. So we can't see all of the smaller gatherings, but we know that this virus tends to travel in these gatherings, that there is a where I'm going to call them super spreader events, even though a small gathering is hard to sort of see the word super there. But most people don't transmit this virus. A small fraction of people transmit it to a lot of people. And so probably these gatherings are where some of this is happening. Hard to prove it because we can't see all those events, but it seems likely that that's at least contributing to this.
Yeah, and just to follow up on that, and how do we, and as we all know, it's become a political issue, but how do we know it's not schools or universities?
Well, so I will tell you that for ASU, our numbers are quite good at the moment. We have very low numbers at the university in terms of students infected. So it seems to me unlikely that it's coming from this university, and I think the other universities are also largely under control. It is certainly possible that it may be schools. We don't fully know the impact of schools, and we're going to have to watch that very closely because schools are opening up now, and that time frame does coincide with this sort of rising number. So it's possible that the schools could be contributing, and I think what we need to do is really watch them carefully and put some testing in place there so that we can monitor those populations more closely.
Dr. LaBaer, this is Mitch Carr with 12 News. It's nice to speak with you, and thank you for holding this briefing. One of the numbers that we've kept an eye on, obviously, is deaths, and it seems like deaths have remained low while the transmission continues to rise. I know you said the demographics tend to be low right now, but it's inevitable that that will eventually be transmitted to older people, and you'll see a change in the demographics. Do you also then expect to see a change in deaths, a surge in deaths to go along with the demographic shift?
That certainly could happen. Deaths are always a lagging indicator. They are the last thing that we see, not surprisingly. It's kind of the last step in evolution of the disease when it happens. We have gotten better at managing this illness. So we're hopeful that we won't see as many deaths this time around as we did in the summer. The doctors are just getting better and better at knowing what to do. But as it will start to hit older people and people with the existing risk factors, and some of them will succumb. The overall death rate for the U.S. seems to be around 2.5%. In the state of Arizona, I think it's also not far from 2%. So, of the people who get it, some fraction are going to get very ill, and there will be bad outcomes.
Hi, Dr. LaBaer. I'm Achi Maneshi, a state press reporter, and I first wanted to thank you for the briefing. I had a quick question about random COVID-19 testing at ASU. A lot of off-campus students have been getting selected for testing, even though they state in their health check that they will not be on campus. So I was just kind of wondering why that is, and how are these students kind of getting selected for that random COVID-19 testing pool?
So the process for random testing is just that. We take the population and we use a mathematical algorithm to randomly pick people. Some people don't believe it's random because they pick several times, but if you look at a Poisson distribution, some people are mathematically just going to get picked multiple times, and other people will just not get picked often. But we do all of our picking randomly, and a lot of that has to do with the notion that we want to care for our entire ASU population. So we care about everybody in our community. And the testing does a number of things. First of all, it gives us a much better picture of who has the illness, particularly if we pick people at random and test them at random. In statistics and epidemiology, there's something called selection bias. If only the people who volunteer for testing get tested, then we're going to get an underestimate of the frequency of the disease, because people who feel like they're sick may not want to show up for testing. So it's important to be doing random testing, and it's important to have a population that complies with that. And then, by getting those numbers, we have a much better sense of the prevalence of the illness in our group.
All right. Thank you so much.
Yep.
Dr. LaBaer, this is Sean Rice with Cronkite News AZ PBS. I had a question about the positivity rate. I saw it was documented that it was at 9% this week, which is the highest in almost 2 months. Yep. But when I look at the number of tests, it's remarkably lower than previous weeks. So how can we manage, or how reliable is that positivity rate if the number of testing is always fluctuating up and down?
Right. Well, so the positivity rate is not my favorite indicator. It has all kinds of issues attached to it. The positivity rate, for example, in an asymptomatic population or in a randomly selected population is going to be very different from the positivity rate of a largely symptomatic population showing up at a clinic, for example. And as you point out, the number of people getting tested can have an effect. If a lot of people get tested, then the positivity rate will drop, because a lot of those people will turn out not to have the virus. They're coming in for asymptomatic reasons. But nonetheless, despite all of its deficiencies, the positivity rate has been a pretty good indicator for us. And when it goes up, that is often a sign of a surge, if you will. And the fact that it has been rising steadily, and then what we do here at ASU is we do what's called a 7-day trailing average. So to kind of to suppress some of those sort of day-to-day fluctuations, we take an average of the last 7 days, including today, and then tomorrow we'll take the 7 days, including tomorrow, and so on and so forth. And that tends to suppress some of the day-to-day variation. And that 7-day trailing average has been rising steadily. It smooths out some of those day-to-day fluctuations, and yet it is going up. And to my mind, that's a sign that we are surging.
Thank you.
Yep.
Dr. LaBaer, Mike Pelton, ABC 15 again. So over the summer when we had that first wave, there were executive orders, mask mandates, and the like that kind of drove those numbers down. With the numbers going up as they are, we've heard, the message out there, you want people to wear masks and social distance, but I mean, at this point, what is going to stop this trend from going even higher?
Well, my biggest hope is that we can get the message to everybody that they need to take it seriously. I think, this comes back to this issue of COVID fatigue and people feeling like, they're tired of doing all this stuff. And what the virus keeps reminding us is that it's not going to go away just because we don't think it's there anymore. It's still there. It's widely spread in our population. And we need to get people to remember that this is serious. I mean, a lot of people's heads are still back in mid-September when things looked really great in Arizona. But the reality on the ground right now is that things don't look really great in Arizona. Our numbers are, we have now more than 1,000 new cases a day. We've had quite a few of those in the last few days and in the last week or two. So we are steadily rising, and we don't want that. So we really have to get the message out there.
Do you think messaging is enough, or would you advise the governor to consider ratcheting up mitigation efforts if it were up to you?
Well, I think the bigger issue is that we have some municipalities have maintained their orders and others are backing away. I would not say that this is a good time to back away from, requiring mask wearing in public places. I think this is a good time. We know that the policies that were put in place last summer worked. There's no doubt that they worked. So it's a good time to be considering those sorts of policies until we can establish more herd immunity.
Dr. LaBaer, this is Mitch Carr with 12 News one more time. I know you've already touched on primary and secondary schools, but you were talking about the random testing at ASU and the sampling, and also just writ large the need for more testing. If you were put in charge of that sort of thing for high school, middle school, elementary school, would you recommend some sort of mandatory random testing? Or is there a best case scenario for high school, middle schools, et cetera, out there?
Well, I think it would make sense to do some kinds of testing for schools. I think it would take a little bit of thought as to how to do it. The number of people in that population is huge. I think there's over 1 million students in our K through 12 population. So that's a pretty substantial order. But some sort of surveillance testing would be great. Certainly, getting tests for teachers who come in contact with lots of students, particularly if there's still plans to kind of do in-person education, getting them tested regularly would be great. And coming up with strategies to do that would be really valuable.
And just as a follow-up, the state has guidelines right now. They remain guidelines. You just mentioned some things that the governor did over the summer that helped and that worked. Obviously, kids were not in school over the summer, and schools were let out basically in April. What's the best way to ask this question? Should there be some sort of a more forceful something more forceful than a guideline that we have right now for how to handle this?
You're getting into more policy things, and that's not my expertise. You're talking about sort of how do we socially manage the population and get people to follow the guidelines? I can tell you scientifically that without a doubt, wearing masks, keeping spacing, avoiding groups, all those things without a doubt work. And we really want to, whatever mechanisms we can find to encourage those behaviors, as well as getting, lots of testing, those are the things that we know work. We've proven that. And so we need to kind of get back to those in the best ways we can.
Mike, Channel 15, my last question. So in its simplest terms, just how close are we to exponential growth and that, for lack of a better way to put it, just point of no return in terms of seeing another huge surge? How close are we?
To be honest, it's hard to judge that right now. The modeling has gotten more complicated because this is now depending on how you want to count it, the second or the third wave that we're seeing. There are lots more people this time following mitigation efforts than we're doing it. Many of you will remember having gone to yourselves to stores in June and certainly in May and seeing nobody wearing masks. It was sort of astonishing. I don't think it's quite so common now. And then our management of disease is a little bit different than it was back then. So A lot of patients that were getting admitted to the hospital are not getting admitted to the hospital now. So there are the things on the ground right now are a little bit different than they used to be. So it's going to be a little bit harder to make that prediction. But judging by the pace we're going now, in about 3 to 4 weeks, we would expect the number from 1,000 a day to be up to 2,000 a day, and certainly that's not a great number to have in the state. So and it could pick up more if people decide to have a lot of Halloween parties, if people decide to have a lot of big Thanksgiving parties, if people continue to gather in large groups. Those things are not going to help us.
Dr. Bill, I had one last follow-up question. It's still Akshay Maneshni with State Press. For these off-campus students who are getting selected for random testing, do you think that it might kind of skew ASU's numbers because they haven't been on campus since spring semester? Or do you still think that random COVID-19 testing is still something that's very good and it could improve the ASU numbers even if off-campus students are getting selected?
Well, I mean, I think, we want to have a good understanding of the prevalence of the virus in all of our populations. We have seen slightly lower numbers of cases in the students who live on campus compared to the ones who are off campus. That may not be surprising. Off campus, people are exposed more to sort of the general public numbers, which is higher than the ASU numbers. But I think we want to know how our students are doing. We care about all of our students, not just the ones who are on campus.
Well, and again, on campus means they live.
They live on campus.
Off-campus living can still be a student who is on campus for activities, for classes, etc.
Right. Okay. Thank you very much.
Yeah.
Any other questions that anyone has this week? Okay. Well, thank you very much. We will be back same time, same place next week. And we appreciate you attending. Any follow-up, you can direct to me or to Sandra Leander. And we appreciate your attendance. Thank you.
All right.
Thank you.
Thank you, guys.
Very much.
Bye.